Parliament ends its sitting for the holiday break, as I said to the government House Leader, hospitals across the country are in crisis. Children's hospitals, in particular, are inundated with respiratory cases right now. Primary care doctors are impossible to find, and nurses are burnt out and leaving the system. Now, the provinces are asking for more money. The Trudeau government, for its part, is asking for modernization and accountability, but there is a stalemate, and the two sides are not meeting. For his thoughts on the issue, we're now joined by Dr. Rod Lim. He is the Director for Pediatric Emergency at Children's Hospital at the London Health Sciences Centre. Dr. Lim, thank you for taking the time today.
Thank you for having me.
Now, before we actually talk about the political situation, I was hoping you might describe for us what's happening at the Children's Hospital right now.
Yeah, it's a very difficult time. As you know, we've had sustained difficulties for over 3 months now. And unfortunately, it is not letting up at all. Although RSV in young children seems to be steady at this point, we are being overwhelmed by influenza A cases. We have not only large numbers of people coming to our department, but the degree of illness and acuity is significant, and that makes huge challenges for us to coordinate care for children, being able to move children between hospitals in order to meet the needs of the community. So it's extremely difficult right now.
So extremely difficult, as you say, to meet the needs of patients. What about staff? How are they coping through all of this?
Yeah, that's the other side, is that the staff that are continuing to show up every day, they're absolutely exhausted. They've been through the pandemic, and I think this is worse. They've had absolutely no break. A lot have left, and we have staff shortages, not just in our department, but across the country. So we are working short-staffed, trying to be creative. The people that show up are going without breaks, working overtime, really just incredibly dedicated individuals under extremely difficult circumstances.
Okay, that's the backdrop, and really it does paint that picture of crisis that I was talking about. But, you know, against it is this political discussion about funding and modernization. What are your thoughts on the debate that's happening right now?
I think it's an important debate because I think beyond the immediate crisis that we're seeing, the need to right staff and right size resources in order to meet the needs of our growing communities is just so important. And I know that these debates are important, but we would welcome any additional support that is possible in order to help us in this current situation.
Mm-hmm. Now, right sizing, right staffing, what do you mean by that?
Well, it's not unusual at all for the winter time to cause surges, especially in the pediatric populations. We know that this has been occurring for as long as I've been a pediatric emergency doctor, for over 2 decades. And so with the addition of COVID as a circulating virus at the exact same time, we know that now and in the future, these surges are going to happen, hopefully not as bad as this year, but they're going to continue to happen. And for a long time, the prevailing thought was to run hospitals as efficiently as possible. And when you run things that efficiently, where you're almost full at all times, it does not allow that flexibility and capability to surge up in times of crisis or in times of increased demand. So I think beyond this year's discussion, we need to have a discussion around right sizing so that we aren't scrambling and attempting to pull out all the stops just to meet the basic needs of the community.
Mm-hmm. Well, you know, the provinces, many of them have surpluses right now, and some premiers are being criticized for not investing that surplus into healthcare. Is that frustrating to hear?
Well, I think right now in the state of our healthcare, I don't think there's a single worker that isn't frustrated by a lot of factors. We want a way out of this, mostly because we care about the children and the patients that we provide care for. And it's very discouraging to try so hard just to meet the demands. And the public has been incredible. We've seen so many people in chairs and in hallways, and they're incredibly understanding, which just tells us how supportive the public has been for us. So we're hoping that governments, I think they're very much aware of the issues. We're hoping that they're going to come up with creative and innovative solutions that mirror a lot of the solutions that have been occurring at the hospital level and the group level, where every day people are trying to be innovative in order to meet that gap.
Now, the provinces are blaming the Trudeau government and the Prime Minister in particular for not stepping forward to talk about their demands. The Prime Minister, in a recent interview, suggested that provinces and territories need to take the lead and take the next step in terms of breaking this impasse. What would you say to political leaders right now? Given the challenge that you're facing at the ground level, what do you want political leaders to know?
Well, I think they all know the magnitude of the problem, and they clearly care about their constituents and the population that they serve. I think the most important thing to tell them is that time is of the essence, and that sometimes helps drive negotiation because provinces and the federal government have their own perspectives that are all important. But unfortunately, we don't have a lot of time to waste. The crisis is now. It's going to be very, very tough over the holiday season with influenza surging in adults and intergenerational mixing that's going to occur over the holidays. So we really need the governments to work together because there's big problems to solve, and if there's delays, that is a significant problem for our society. So we really need to get on this and work together.
Dr. Rod Lim, thank you again for the time today.
Thank you.